Welcome to UC Health's Westchester Hospital. Our team of medical experts is committed to providing quality, compassionate care during your surgery or procedure and throughout your recovery. Please park your car in our convenient parking lots, which provide quick, easy access to the hospital's main entrance. Be sure to leave jewelry and other valuables at home. You are welcome to have a loved one or support person join you on the day of your surgery. They will have access to a comfortable waiting room, our cafe, and gift shop, as well as nearby restaurants. Be sure to ask for assistance whenever you need it. When you arrive, you will check in with our hospital volunteer representatives at the main lobby front desk. You will be given a pager and asked to have a seat in the main lobby waiting area until the pager alarms. Wait times can slightly vary. A patient registration representative will greet you and escort you to a registration alcove, where they will review relevant information with you. This includes your driver's license, ID, and insurance, which will be scanned into your chart and will also verify all of your demographic information, including address, phone number, employment, emergency contacts, religious preference, preferred name, pharmacy preference, primary physician notification, and family notification. You will also be asked whether or not you have recently traveled out of the country. Other questions might include when your symptoms started, if your surgery is due to an accident or injury, and if so, when the accident occurred and how. The registration staff will obtain your signatures on several forms, which can include advance directives, the Health Insurance Portability and Accountability Act, HIPAA, and if needed, the important message from Medicare, IMM form for Medicare patients. As a safety precaution, the representative will place an armband on your wrist and confirm the spelling of your name and date of birth. Copies of your face sheet, a document that concisely lists all of your health information, will also be given to you. After the registration process is complete, your next stop is the surgery department on the second floor. We are glad to assist you in any way. Wheelchairs are available if needed. Please check in at the surgery reception desk, which is staffed by a patient representative and a volunteer who will provide additional instructions and our surgical services information guide. You may be asked to wait briefly in the waiting area. A member of our team will then escort you to a pre-operative room. A family member is welcome to join you in this room before your procedure. A pre-op nurse will clarify any additional medical information, briefly review the surgery process, answer questions, and fulfill any needs or requests. You will be made as comfortable as possible, including warming blankets and other comfort measures. When it's time to go to the operating room, an anesthesia provider, your pre-op nurse, and a surgical nurse will perform a safety check with your involvement. They will restate and confirm your name, date of birth, surgical procedure, and other pertinent information about your procedure and health status. Once all information is reviewed, you will be taken to the procedure area. At that time, your loved one will be escorted back to the surgery waiting area. A large patient tracking screen provides real-time updates about patients as they move through the surgical process. Patients are identified by a number in order to protect patient confidentiality. In addition, the reception desk representatives will keep your family informed throughout your surgery. At this time, your anesthesia provider will gently administer medications they discussed earlier in the pre-op room. After your procedure, you'll be transported to the recovery area. Your physician will talk with your family member in a private consultation room to provide an update about your procedure. While you wake up from the anesthesia, recovery staff will closely monitor your status to ensure you are safe before allowing one family member to see you in the recovery area. Your recovery time in the hospital will vary depending on your surgery or procedure. Our goal is for you to safely return home as quickly as possible. If you are going home the same day, you will return to the pre-op area and be prepared for discharge. If you are admitted to the hospital, you will be taken to your new room at the appropriate time. Your family will be notified of your room number so they can meet you there. Once your doctor approves you are safe to return home, you will be given discharge instructions by your doctor and nurse. Please ask any questions at this time. If you have a prescription to be filled, Our outpatient pharmacy offers the Meds to Beds program, with medications being delivered to your bedside. Once you are officially discharged, a staff member will escort you to the front entrance by wheelchair. It is extremely important to follow your post-operative instructions once you arrive home, as doing so enables safe healing. If you have any questions about your recovery, please let us know. Your doctor and our care team are glad to provide you with helpful guidance and information. Thank you for choosing Westchester Hospital for your healthcare needs. The #1 priority for our team of caregivers is to provide you with quality care with the highest levels of safety and customer service. Thank you.